Hello, my name is John Fletcher. I'm the president and founder of the Cluster Headache Foundation. Founded in 2012 to try to help bring everybody together and bring all the information out there together into one place was my idea. Anyway, recently I made a video using high flow oxygen. I wanted to explain a little bit about using high flow oxygen. The tanks that I use this is from a concentrator that fills bottles. This regulator is a demand valve regulator. Turn this on. And you can see it comes out at 40 liters per minute. So I can literally sit there and inflate my lungs using this bottle. That's why the concentrator oxygen works using it at high flow rates. 15 to 40 liters per minute is considered the range to use high flow oxygen for cluster headache attacks, depending on the patient's lung capacity. Some of the bigger guys, 200 or 300 pound guys, they need that 40 liters per minute to breathe at supporting hyperventilation and get the quick 5-minute aborts that they can deliver for a cluster headache attack. Anyway, I wanted to show you that the concentrator oxygen does work supporting hyperventilation. Using a concentrator alone does not work, because most concentrators only go to 8 liters per minute, and maybe 12 at the most, and that's not enough to stop a cluster headache attack. It's not enough to stop a cluster headache attack if it was pure oxygen, unless you respond very well to oxygen overall. So using high flow oxygen supporting hyperventilation is the way to go for the quick 5-minute aborts. You breathe it as deeply and as quickly as you can without getting too dizzy. Obviously, it's just common sense to breathe and not pass out. Supporting hyperventilation, that's a possibility, so you just be cautious, and should be no problem at all. So to expel the myth that concentrator oxygen does not work, it does work, but it has to be the concentrators that fill bottles, so you can use it at high flow rates using a special regulator with high flow capacity. And another thing I wanted to bring up about cluster headaches is research. In the last 25 to 30 years, we've only had $2 to $3 million in cluster headache research by our community, our medical community. That's not enough to do much for any condition. We desperately need research to stop these headaches. We're losing patients at a suicide rate 20 times the national average. 20 times the national average. And that's an awful lot of people we're losing, because these are such severe headaches and such severe pain that I personally, in my life as a commercial fisherman, have never experienced anything that even came close to a bad cluster headache attack. I've broken almost every bone in my body. I've had severe illness and painful illnesses that you would think nothing would be more painful, but I still to this day have never come close to having anything happen to me more painful than a bad cluster headache attack. They are absolutely horrible, and this has to be stopped. People are taking their own lives because of these headaches, and they're not the only ones. Migraine as well. Cluster headaches is considered the most severe pain a human being can endure. That's saying quite a bit coming from the medical community. It's also been said that these headaches, because they only last 3 hours, if they were to last longer, we'd have an awful lot of patients wanting to take the quick way out. They're just that severe. The pain is just unbelievable. and it needs to be taken far more seriously than we have in this history of these headaches. That's one of the problems right there, is the word headache. Everybody's had a headache, and when you mention or say the word cluster headache, everybody relates to whatever headache they've had. So if they've had a bad headache, they think, oh, okay, then that's probably what it was, a cluster headache. Well, that's not necessarily true. Cluster headaches don't just happen once or twice. That is extremely rare. It's usually a disease that starts from day one and goes throughout your entire life. Some say that the disease stops in your 50s, but there's no strong evidence of that, and is something that may be putting out too much hope. But it's a disease, a condition, disorder, syndrome, affliction. All are correct, but we need more research to narrow that down. We need to get a better handle on why these things happen, what starts them, and the chemical imbalances or chemical reactions that affect the hypothalamus in the brain, and cause these headaches to come on at the exact same time every day, or if a person is episodic, have your cycle start at the exact same time to the day the following year. It's just an amazing disorder, and we need to learn an awful lot more about it. We desperately need research, and that's going to be the key to this whole thing, is research dollars. Because without research, we're not going to learn anything, and we desperately need to learn more. I want to thank you for listening to me. I'm hoping that the video that I created here is helpful. I apologize for not using a non-rebreather mask in my video that I did. My mask was actually, the bag popped, so I couldn't use it. But it's, with high flow rates, using it straight from the hose will work. Don't ever get discouraged. Just if you happen to have don't have the right mask, or if you just have a hose, whatever the situation may be, you always try to abort the attack. Don't just give up thinking you have a bad mask without trying. So the key is high flow rate, 15 to 40 liters per minute for those quick aborts. Just use common sense and caution, and should be able to abort those attacks pretty quickly with most cases. Sometimes those bad attacks, the TENS, can't be stopped, unfortunately. But for the majority of the attacks, high flow oxygen is our best option, absolute best option. We are in a desperate situation, an extreme situation, and people are taking their lives. We have to do something about this. This has to be stopped. It absolutely has to be stopped. We can't pass this on to our children and our children's children. The disease is also hereditary, as well as migraine and other headache disorders are hereditary. And by gosh, they are not just headaches. We wish we had a different word for it, but headache is the word we have to live with. I hope that I clarified that to some extent. These are absolutely not a headache. This is the worst descriptive word we could have ever come up with for pain this severe. Thank you very much, ladies and gentlemen. Thank you very much. And blessings and pain-free days I wish for everyone. Bless you.